Why do you think vaccines are crucial for children?
Vaccination is a worldwide practice because the system has been tested.
What were the ingredients of immunization?
The biggest enemy of immunization is blind belief on rumor.
So true.
If anybody took any one story to any one corner of the state, it would create this fear. We had to break that taboo. The hard to reach areas needed better communication systems. So therefore we talk about delivery of healthcare services by interfacing it with technology like the drone technology.
Yes.
We are improving our roads. We are building better bridges. We do not want to compromise.
How the data is helping?
Data, without doubt, will be able to tell us which direction to take. Give the child 1,000 days. 1,000 days would be inclusive of not just vaccination. There's a lot of other ingredients in that pack. Early childhood development mission also includes mental health. Why are these teenage pregnancies happening? What are the factors that are missing out in our homes? How do we supplement emotional growth of children for any child to have a fair chance to good life? Let's work on this.
Hello and welcome to UNICEF Talks. I'm Dr. Madhulika Jonathan and I'm the Chief of UNICEF's Field Office for Assam and Northeast States. And I'm really excited to bring to you this special episode of our podcast, Vaccines Save Lives, and ensure that every child survives and thrives. And we know that immunization saves the lives of about 3.5 to 4 million children worldwide from special diseases like measles, tetanus, and flu. And behind this incredible work is the commitment of communities, frontline workers, and committed leaders. And speaking of leaders, today we are bringing you this episode from the beautiful hills of Meghalaya, where I'm joined by an incredible change maker, Dr. Mazel Ampareen Lyngdoh, Meghalaya's Honorable Minister of Health and Family Welfare. And she needs no introduction, but I'm going to speak a little bit about her. Dr. Lyngdoh's journey is all about public service, and she brings so much passion to her role, whether it's health, equity, youth engagement, or using tech to improve healthcare. And she has played a remarkable role in taking health services in Meghalaya, be it from immunization to maternal health. And the global audience must be wondering why we are sitting in Meghalaya. And UNICEF works in Meghalaya largely to bring attention to the large tribal population and also to the geographically difficult to reach areas in Meghalaya, making this state a quiet hero in the area of child health. When there is a people's movement to make change for health, nothing is impossible. Be it mobile vaccine clinics, which Meghalaya has done, using the drone to deliver vaccines, and also the ASHA worker, the frontline worker, going home to home, delivering services, identifying children and pregnant mothers, and making services happen on the ground. So stay tuned in, because this conversation is going to be extremely engaging and very inspiring. So Dr. Lyngdoh, before we really jump into the details of our immunization conversation, it would be really lovely, and we were talking about it a little bit prior to starting the podcast. Tell us a little bit about Meghalaya. What is Meghalaya? What are the traditions? What makes Meghalaya special?
Meghalaya is a very unique state because of various factors. The first factor, the beauty, the scenes that you see around us, the waterfalls, the practices of the living root bridges, the unique fabric and build of our communities. Meghalaya is unique also because predominantly the people of the state are open to conversing in a language that is understood by all.
Okay.
Fluently, you will see even a vegetable vendor or a doctor or a politician quickly speaking in English, which is again very unique to the people of the state of Meghalaya.
True, true. I think when we speak about UNICEF's work with Meghalaya, the collaboration has been very intense, and we have worked closely for about a decade, more than a decade, looking at redesigning health services, ensuring identifying the difficult areas, reaching out to communities that were unaware of health services, and ensuring that government services reach them. So to start at the very beginning about immunization, Dr. Lyngdoh, since the audience is also listening in, our caregivers, their mothers and parents, why do you think vaccines are crucial for children? And how early should mothers and parents and fathers, for that matter, reach out for these services for their young ones?
If a state does not have faith in a tested module like vaccination, see, because vaccination is not local in its nature. Vaccination is a worldwide practice because the system has been tested.
Okay.
So Meghalaya starts there.
Okay.
We need to invest on a tested mechanism which has proven beyond doubt that vaccination does improve the life. So we want to invest on something which has been tested worldwide, and hence vaccination for us is an important component in the healthcare system. Period.
Absolutely, absolutely.
We do not want to compromise on that.
No, I think that is a very, very committed stance of the government, and really I'm happy to hear that from you as a leader for the Department of Health and Family Welfare. So, we have been looking, as UNICEF, we've been working closely with the department, and we know that Meghalaya has reached a sort of significant milestones in immunization. Share with us a little bit about how this progress happened. What were the ingredients of change?
The biggest enemy of immunization is blind belief on
So
rumor,
true.
faith on this fear that if my child has a fever just after a vaccination dose, it is not good for the child. So there are these, inherent things that we kind of see happening around the communities where maybe a religious organization says that you are discouraged, and in fact some of them go a step forward and say we forbid you to go
Very unfortunate, yeah.
and believe in anything which is medical in nature, which is away from the teachings of whichever religion they are propagating. So these are some of the factors which deterred the protection of every child in the state of Meghalaya from diseases which can be treatable if attended to from birth. So, having put that in perspective, because our IMR was very high at one point in the state of Meghalaya, and we had engaged productively with several organizations over the years to help Meghalaya understand what are its peculiar challenges. We then received the results of such engagements with public, and hence we decided that if immunization is to work, it should be people oriented.
Absolutely.
It is the citizens themselves who can help protect the children of those communities from unnecessary disease which can be avoided if a vaccine is to be given to the child. So that was the biggest, I think, the biggest challenge that we had, because we are small communities, especially in maybe 3 decades before, there was no social media. So if anybody took any one story to any one corner of the state, it would create this fear, and there was no other additional source of information.
Yeah.
So the next thing that we decided to do was empower the communities, make them the ambassadors of this necessary requirement for change, give and provide literature, or access to information to the public through our various sources. It could be through our health workers like the Anganwadis. Now we are also interfacing the Anganwadis with the Ashas
Asha
because
workers.
this also was necessary. Anganwadis would identify the statistics of the growth of children, and then the ashas would then identify what are the important components that are lacking in the opportunities for a particular family. So we started this joint approach, and we started making our ashas believable, our Anganwadis authorities of information, because we had to break that, taboo that information was coming only from one source. Today, in this generation, I think we more or less are now coming face to face with other issues. So, a remote incident will happen in some remote place in some part of the world, and then it is brought into our communities. So, all of this is now a dynamic situation, and as a state, we are trying to stay focused. We are trying to ensure that we engage with church leaders
Okay.
who are authorities again. We engage with, you know, civil society leaders. We have several NGOs, and these NGOs also are participating in some of our programs.
I think this is a very pragmatic storyline that you have, and it's really giving the ingredients of change. And if I'm thinking back on your very clear articulation of the whole thing, the strength of communities, the trust that health workers are building, and also the influence of the influencers, whether it's faith based or just people who live within the communities, and then leaders, change makers like you who are nudging the change. I think that is what Meghalaya is basing its whole progress on, and I'm really looking forward to this journey with you. You spoke a little bit about data,
Yeah.
and you spoke about how the data is helping.
Yeah.
So share with us a little bit about the critical role that data plays in helping you to sort of stay needle to the pole, stay guided in the right direction, helps health workers in the right direction, policymakers in the right direction. What are your thoughts on this thing?
So, Meghalaya at the initial stages, maybe about 2 decades back, was actually groping more or less without a direct policy, without a focused input from experts. So today we have the UNICEF working with us. Today we have the World Bank working with us. Today we have all of these big, big organizations helping us go forward. So then we've realized that the hard to reach areas needed better communication systems. So therefore we talk about delivery of healthcare services by interfacing it with technology like the drone
Drone,
technology,
yes.
like you correctly indicated. We are improving our roads, we are building better bridges. We are also making sure that we have this reserve healthcare workers who will be there to quickly draw their attention whenever these indicators from these professional bodies indicate that that area remains uncovered, that area remains uncovered. And then we dovetail that with ensuring that who is the most influential person or organization in that particular area. Firstly, we break all the barriers of information with these individuals or this organization. So, data, without doubt,
True.
will be able to tell us which
True.
direction to take.
True.
And state is now beyond manipulation of data, because there's so
That
many
is very
systems that have
exciting.
been brought into the country. Aadhaar, for example, whether you like it or not, Aadhaar is going to be a big source of data, because there as well, health workers and village and community organizations all have to register themselves. So I believe that we are now informed, we are now aware of where the challenge lies, and we are very, very grateful that all these international organizations that have delivered in other parts of the world, in other parts of the country, are now working with us.
True.
Because this gives us an opportunity also to review ourselves and to make an effort to try and bridge all these gaps.
I mean, when you speak about data, and you speak about numbers, and I think what comes to my mind is when we were working in the field in Meghalaya, there was a saying which said that behind every number there's a child.
Yes.
So, I mean, it's so heartening to see that, this whole piece is not just the number game, as you said, and it's more close to the health worker's heart. She knows who to follow with, whether it's the Asha or the Anganwadi worker. And it's been an empowering exercise. The way I'm listening into it, it's empowered them. It's helped them to take ownership of their own community children, so to say, and then to take this data to decision makers. So this is very heartening, and I think this is something that other states can learn from, because whenever there are exigencies, when there are emergencies, when there are left out children, if they can be sort of picked up and the health workers can reach out very quickly, I think that will really change the numbers for immunization. So moving from immunization, but still staying there in the same part of the life cycle, Meghalaya has done really well in early childhood development. And this is something that UNICEF has worked very closely with early childhood development, what we have referred to as nurturing care. And tell us a little bit about this initiative. Tell us how it matters, how it has helped shift numbers, shift situations in Meghalaya.
So, at one stage in the history of Meghalaya, we had isolated all of our programs from each other. The gaps between our programs never had a connection. So, if I was a teacher, it would be my sole responsibility to just teach this child.
Exactly. Yeah.
If I was a doctor, it would be my earnest attempt to ensure that as a doctor, I'm available in a community and I attend to all the health emergencies
issues,
that evolve around me. So today we have shifted gears, and we have said that if you are a teacher and you notice that there is malnutrition to a large degree in your classroom, it would be your bounded responsibility to immediately report this apparent appearance of malnutrition in the classroom. So, therefore, this integration of departments and this joint effort being put in is the culmination of this early childhood program that the government of Meghalaya is engaging in. I think that once we have identified a child who is malnutritioned, and this is reported to a parent of the child, this takes the health worker to the house of that child, and this then brings in an opportunity for health workers to view the status of family members, status of mother, status of other siblings. And this creates a very positive chain. This chain is what is connecting us together.
Yes, yes.
Why is a child malnutritioned? Child could be malnutritioned because of various reasons. It's not probably just because of vaccine hesitancy, but it could also be a culmination of other related conditions of that family. So the government of Meghalaya feels that we are now trying to promote programs in the area of early childhood development, and we've called it the Early Childhood Development Mission, so that we can ensure that our policies are matching the adoption of these policies all the way to the last family in the last village. We have to make sure that that works. Now we are encouraging the 1000-day program to be followed following the birth of a child.
Okay.
Give the child 1000 days.
Yep.
1,000 days would be inclusive of not just vaccination. There's
Yes.
a lot of other ingredients in that pack. Mother should space the child if you need to give 1,000 day attention to this child. Father has to ensure he
Yes.
participates
Responsive
and make
parenting.
sure that he is also involved in ensuring that this 1,000 day attention that you're giving that child becomes a progressive attempt to give this child a fair chance to quality of life.
Absolutely.
Within these 1,000 days, which is approximately three years plus years of the child, we can all focus on this one child and give this child a fair chance of
Chance.
survival.
Yeah. And thrive.
So these are the kinds of unique programs that we feel we need to encourage in the communities. I hope that this will bring good results. So then early childhood development mission also includes mental health, the trauma that some of our kids face in homes when there are factors because of lifestyle that torment a child, that disturb a child. What is this problem of teenage pregnancies? Why are these teenage pregnancies happening? What are the factors that are missing out in our homes? How do we supplement emotional growth of children? This is all
Absolutely.
part of that large landscape that we're
Canvas.
looking at.
True. True.
And we hope that we'll be able to achieve it better.
You spoke a little bit about, vaccine hesitancy, and we have also seen that Meghalaya has done well. How do you think public attitude, or you spoke also about different communities believing different things. So how do you think this works? I mean, in the sense that the vaccine hesitancy can be overcome, and how does the government then look at maybe addressing some of the vaccine hesitancy?
So you see, it's a very crazy situation to be at. Typically, we remember you can take, the saying which says that you can take a horse to the nearest
To
pond, but
water.
you cannot force the horse to drink the water. So now, as a state, we are trying to figure out what is the best way to break this false belief that vaccines are the root cause of some of the reasons for the loss of children in our communities. There have been sporadic incidences where, because of hundreds of reasons, a polio drop may have gone wrong. But the problem in a community as small as the one that we have prevalent in the state of Meghalaya, we have to find ways and means to break this taboo. Recently, there was an incident in the western part of the state of Meghalaya where there was this one case where there was likely a reoccurrence of a polio child after several years, maybe 2 decades. And there was a big scare in that village. So this gave the health workers, the health team of the state of Meghalaya, the department in general, an opportunity to design a module as to how do we work on rebuilding this faith of that community on our health
On our
system,
system, the trust building
the
again.
trust building. So we took a backseat and we needed to send workers to try and find out how do we break that information down and how do we ascertain that this reoccurrence of polio case in that village does not then have a ramification of information
To
into the
others.
rest of the state. So our officers engaged actively and we have tried our best to bring in information which indicates that this is one out of the 10,000
More than that, I would say. Yeah.
or
Cases,
whatever
yeah.
lack number of the cases that have proven that the polio drop can defend a child from a probable attack of polio and probably even be crippled for the rest of their lives.
True.
So, like this, we are working on this hesitancy. To be very honest with you, this continues to be a problem for us. We do not have ready made answers, but we are hopeful that integrating the education, the health, the religion on one platform may be a solution to this otherwise remaining problem. And we don't know whether it will change and we will likely come to that full immunization
You will.
platform, but we are trying our best. I believe that we are breaking the taboos, we are breaking this information which is incorrect. We are grateful to the government of India for giving us this opportunity to create these health and wellness centers everywhere. Now, these health and wellness centers are actually institutions which are manned by them. They themselves donate the lands.
Wow.
They themselves take care of the building of this institution. Some of the health and wellness centers are also now integrated with labor rooms. We are reaching out through the village organizations, the DHIs
Okay.
that deliver these babies in remote conditions, unhygienic conditions, conditions which are not going to be good for the mother and the child. So, once a DHI is trained, we believe that she is the caregiver of a particular community. We are putting up our hopes and investing on this training of DICE
Okay.
so that they can then break up this information. That is one way of doing it. The second way, like I told you, is involving the community members themselves, because our darbars are very respected
Okay.
entities
Across the region.
the entire state. You may call it something else in Garo Hills, you may call it something else in Jayanti Hills, you may call
Okay.
it something else in Khasi Hills. But this is the inherent strata that we have in our community. We hope that in the coming years, slowly and slowly, we will increase and better our institutional deliveries. Certain areas, it is already 100% now.
Okay. Okay.
Certain areas, it's still at 70, 85. We still have, this cultural background, where if my child is having a child, I have to ensure that my grandmother delivers this child. So we still have some of
So
those
those
concepts
traditions,
and traditions, and so we hope that we will slowly, slowly integrate all our approaches and make sure that these traditional beliefs and thoughts get slowly integrated with modern technology, modern approaches,
modern thinking for that matter.
modern thinking, so that we are concerned solely of the health of a mother, the health of a child, which is at this point of time a big weakness in our system.
I think best interest of children is what we are looking for. And I think that should be sort of the overarching principle of our work. Um, I think one thing that really different states, because, and this is a global audience, would be interested to understand is that when you spoke about vaccine hesitancy, you spoke about different players, stakeholders that helped to address it. What were some of the sort of critical steps that were taken?
So, like I told you, we've taken a concerted effort to map all these areas which remain unimmunized.
Yes.
We found out that in a particular place, maybe it was having to cross a river for most of the year because we have a lot of rain in our state. So it was difficult to get from this village to that village because there was no bridge. I have been to one such village just recently. Mao Karwang it was called. I had to go down 3.5 hours and I had to come
Oops.
up 4.5 hours.
Mm.
So, how do you ensure that children of those three villages down there have access to that vaccination?
Vaccination.
So, maybe it is not so much the hesitancy, but like I said, the lack of information, trust in a particular vaccine because of no information as to what would be the good things that that vaccination will give me. So, as a minister, what did I do? I walked. I went down with one of our NGOs who are involved in the provision of healthcare facilities to communities. And when I got down to this village, I realized that there was this big community there which had zero information on a lot of important components of healthcare. So I came back, I walked up, it was very difficult, but I looked at it as a challenge. I came back to my government and I requested the Honorable Deputy CM in charge of roads to please do something and fix the road that was anyways planned to reach this location
Location.
and didn't get done only because of matters of allocation of land or contribution of land by these villages. Because by the time I got there, I realized that that could be easily resolved. So today I will go back to that village where road is in position and it's a happy situation all round. The other thing that I found out in some of the villages as to why there is this so-called hesitancy to vaccination, but believe me, they just don't understand hesitancy to vaccination. They don't even have basic information. Your child will have a fever, it's okay, give the child a paracetamol.
Paracetamol.
Make sure the paracetamol is available for the child. Explain the doses properly to the parent.
Right.
When my child gets sick, both me and my husband have to stay back to tend this child who's going to bring food to our table tomorrow.
True. True.
So, all of these, I think, are a part of this hesitancy, at least to my knowledge, in my state. You're sending a health worker down those steps in Maukarwan. You're sending that health worker, you're sending that doctor, you're sending that ANM, you're sending everybody down and up those steps. How many times in a week? How do you expect people to be committed?
Exactly.
So we must make sure that if you're sending these people to hard to reach areas, they also have a systemic backup. I'm taking a vaccine to a village which is 4 hours away from the nearest PHC. Make sure that this vaccine is also sent with the necessary backup. You can't bring the child to the center 4 hours away. A lot of our mothers remain isolated because they are far away from the nearest health center, do not have tetanus. What do you expect the child who will be born to be like? So, again, right from the womb, I believe there are going to be these technical difficulties for any child to have a fair chance to good life. Let's work
Absolutely.
on this.
Yes. Yes.
And when policy decision takers need to take these decisions, do not take them in isolation from ground realities. Sometimes when I go for my tours, which I do very often because it is a big love that I have to reach out and see for myself rather than hearing information from an official who probably will give me a report which is biased to some extent. I go by myself. I found out that several of my PHCs and CHCs didn't have power because there was a big rainfall, there was a thunderbolt, the power got disconnected. Again, it challenges to how do you ensure that you give the best health to our communities. So today we came back to my government, to my CM, to the other cabinet colleagues and said, why don't we have backups for availability of power in our centers. So today we have a mix of grid power
Plus
plus solar power plus
backup.
backups. Install batteries that can have proper backups to a certain hour. If that fails, what happens next? What happens next? Because whether we have rain or whether we have thunder, you can't stop a child from being born in any place. So this is the kind of preparedness that we must have. This is the kind of approach that we must have. Officers on the ground are doing a lot of hard work, but we need to make sure that we hear from them, hear their
Their
reasons
stories.
for all of this. And then, of course, there is other more complicated hesitancy factor, which is, of course, a religious belief. It's difficult to have ready-made
But you have a
answers,
plan. Yeah, yeah.
but we are working on it, and we are hoping that we'll be able to communicate efficiently to our faith leaders that alongside the faith must be the practical requirement for health.
Absolutely.
We're working on it.
Now, this has been wonderful listening to you. And also, the balanced approach that you speak about, being grounded, visiting this group of villages which you speak about, which now has a road. So, I think what really strikes me personally is that, how Meghalaya as a team, as a government, you are making that every child is important and every child counts, and that you will not, giving up is not an option, and that whether it's vaccine hesitancy or wanting to reach the 100%, beyond the 85%, that is something that very determined to reach that along with all the workers. I think one thing that is very important, the point that you raise and what you have felt has done very well is the community engagement. And when you speak that policies must be, I would use the word, run by communities, so that it must be relevant to them, must be relevant to what they are looking for their children and for their future. I think that policy resonates when it's operationalized at the community level. I think that is a very important thing. So just thank you so much for your time. It's been a pleasure listening to you, and also gives us as UNICEF, a great privilege to be part of this journey. Thank you so much, Dr. Lyngdoh. Wonderful speaking with you.
Thank you.